There are four fundamental pillars in becoming not just a skilled and a respected doctor, but also a good human being. If you really want to become unstoppable in your clinical practice, then obviously the first one is knowledge, the second one is empathy, the third one is communication, and the fourth one, which is often overlooked or even we fail to realize, is the respect for women. You know that every medical student aspires to become a successful doctor, skilled practitioner, or a renowned surgeon. And beyond the profession, as a young medical student, we often dream of financial independence, luxury cars, prestigious hospitals, and even gaining public recognition. So there are four fundamental pillars without which you cannot reach the zenith in your clinical practice. The first one, obviously, is the knowledge. It is the foundation of the medical expertise. Without knowledge, you cannot become a doctor. As simple as that. Second one is the empathy. It is the ability to understand and share the feeling of the patient, and it is essentially required for you to evolve, because after 3 to 4 years of your practice, it is not what you have learned in the post-graduation or during the post-graduation. It will be your own experience and expertise which you have aligned with the feelings of the patient is responsible for evolution of the medicine. The third one obviously is the communication. So it is the basic bridge in between the diagnosis and the trust. If you are not able to communicate what you feel it to the patient, there is no point in managing the patient. And the fourth one is the respect for women. This is one thing which we often overlook or even fail to realize, but this is the most important fundamental pillar of the true success, which is respecting a woman. I know that it might seem unconventional, even laughable to some, but neglecting it could be the biggest mistake of your career. So let's decode why is it essential to respect a woman in clinical practice. First, once you step into the clinical practice, you will realize that a significant majority of the patients in the various fields are women, whether it is OBG, the pediatrics, or even in orthopedics. You choose the sector, majority are female. Now in healthcare, trust and comfort are not just important, they are essential. A doctor who upholds dignity and respect fosters a sense of safety for female patients. And when a woman feels safe, she communicates more openly, becomes more confident in the treatment process, and ultimately the path to healing becomes smoother for both doctor and the patient. And this practice game, it runs on recommendations, and a female is a recommendator, and the recommendations are asked from females. So just imagine if you are one shady or a cringe man who don't know how to behave with the women, or if you are someone who lacks the basic respect for women, then obviously the medicine is not the field for you. Second point is that medicine is a field with a significant number of female doctors, nurses, and staff. Your attitude towards them, whether it is a colleague, a senior consultant, junior resident, or even a nurse, shapes not just your reputation, but the very culture of that workplace. A doctor who cannot treat the female colleague will struggle to earn the respect of the patient, peers, and the society. And in medicine, the character matters just as much the competence. And most importantly, with the changing patterns in future, as more and more corporates are about to engulf the medical sectors, so with this comes the so-called normalized harassment of the females, and it is not only you, it is your duty not to make it happen under your very own eyes. I hope by this time you have already realized that those who fail to understand the basic etiquette of interacting with the women can make her feel deeply uncomfortable, not just with the world, but through the inappropriate comments, even the ocular gestures, or even the body languages. So respect isn't just about avoiding the disrespectful behavior. It's about actively upholding the dignity. If you truly commit to being respectful, it's not enough to simply watch your own actions. Ensure that others around you do the same. So never engage in or tolerate the conversations that demean a woman in her absence. So even in her absence, you do not have to talk about it or talk about her, because true respect is practiced both in the presence and in the absence of that particular person. And remember, your simple act of respect can have a great impact on the society. So as a doctor, you are not just someone who treats the illnesses, you are the role model. People trust you not only for your medical skills but also for your honesty and behavior. So everything you say and do, it matters. The way you treat a woman, whether they are patients, the colleagues, or the staff, it set an example for the others. A simple act of respect can make a female patient feel safe, support a colleague, and encourage younger doctors to do the same. When doctors show respect, they don't just help the patient, they help build a better and more equal and comfortable society. So 2 points in conclusion: don't just act, learn how to respect a woman. The way you treat a woman reflects your true character as a doctor, and it is essentially important for you to have a character when you are a public figure. And remember, respect isn't optional. It is essential.